Hello everyone. If you haven't subscribed to our channel yet, then subscribe to this channel. Florence Nightingale is a transcending figure throughout the entire existence of nursing and medical care. Frequently alluded to as the woman with the lamp, she is praised for her spearheading work in current nursing and her commitments to general well-being. Her life and inheritance keep on inspiring ages of medical services experts around the world. This paper digs into her initial life, momentous commitments to nursing, her job during the Crimean War, and her enduring influence on medical care and nursing instruction. Early life and schooling. Florence Nightingale was brought into the world on May 12, 1820, in Florence, Italy, to a rich and well-connected English family. Her parents, William Edward Nightingale and Frances Smith, named her after the city of her birth. The Nightingale family returned to Britain not long after her birth, settling in Derbyshire and later Hampshire. Since early on, Florence showed a sharp mind and an enthusiasm for learning. Her parents, especially her father, were supportive of her education, providing her access to tutors and a wide array of subjects, including science, philosophy, and languages. Despite the cultural expectations of the time that women should focus on domestic roles, she was determined to pursue a meaningful career. Calling to nursing. Florence felt a strong calling to serve others and was drawn to nursing, a profession that, at that time, lacked formal recognition and respectability. Nursing was generally performed by untrained women from the lower classes and was not seen as a suitable occupation for someone of Florence's social standing. Despite her family's initial objections, Florence pursued her passion and sought training in nursing. In 1851, she enrolled in a nursing program at the Institution of Protestant Deaconesses in Kaiserswerth, Germany, where she received formal instruction and practical experience. This experience solidified her commitment to the nursing profession and ignited her desire to reform healthcare practices. Contributions during the Crimean War. Florence Nightingale's most famous contributions came during the Crimean War, 1853 to 1856, a conflict in which the British, French, and Ottoman empires fought against Russia. Reports of inadequate medical care and appalling conditions in military hospitals reached the British public, prompting widespread concern. In 1854, at the request of the British government, Florence Nightingale was appointed to lead a team of 38 nurses to the military hospital in Scutari, modern-day Üsküdar, Turkey, to improve conditions. Upon her arrival, she encountered terrible sanitary conditions, overcrowding, and a lack of basic supplies. Many soldiers were dying not from battle wounds, but from preventable diseases like typhus, cholera, and dysentery. Florence quickly set to work implementing changes. She reorganized the hospital layout to improve ventilation and sanitation, introduced hygiene practices, and ensured that patients received adequate nutrition and care. She also collected detailed statistics on mortality and disease, which she used to advocate for further reforms. Florence's unwavering dedication to her patients earned her the nickname the woman with the lamp, as she was often seen making rounds at night, tending to the sick and wounded by lamplight. Her compassionate care and attention to detail significantly reduced death rates at the hospital, saving countless lives. Foundation of modern nursing. Florence Nightingale returned to Britain after the Crimean War as a national hero, but she was determined to continue her work in healthcare reform. She used her newfound fame and influence to advocate for improvements in sanitary conditions and healthcare practices, both in military and civilian hospitals. In 1856, Florence Nightingale presented her findings and recommendations to the British government in a report titled Notes on Matters Affecting the Health, Efficiency, and Hospital Administration of the British Army. Her report emphasized the importance of sanitation, proper nutrition, and trained nursing staff in healthcare settings. In 1860, she founded the Nightingale Training School for Nurses at St. Thomas Hospital in London, marking a significant milestone in the professionalization of nursing. The school provided rigorous training and education to nurses, emphasizing the importance of cleanliness, patient care, and scientific principles. Graduates of the school became known as Nightingale nurses and went on to establish nursing programs worldwide, spreading her methods and philosophy. Public health advocacy. Florence Nightingale's contributions extended beyond nursing to public health advocacy. She was a pioneer in using statistical analysis to inform healthcare practices and policies. Her innovative use of data visualization, including the creation of the polar area chart, often referred to as the Nightingale Rose diagram, illustrated the impact of sanitary conditions on death rates. Throughout her life, Florence worked tirelessly to promote public health reforms, advocating for improved sanitation, clean water, and better living conditions. Her efforts contributed to significant advancements in public health and laid the foundation for modern epidemiology. Challenges and personal life. Florence Nightingale faced numerous challenges throughout her career. Her work during the Crimean War took a toll on her health, and she suffered from chronic illness and fatigue for much of her life. Despite her physical limitations, she continued to work tirelessly, corresponding with government officials, healthcare professionals, and reformers to advocate for change. Florence remained unmarried and dedicated her life to her work. She was deeply religious and viewed her nursing career as a divine calling. Her writings and correspondence reflect her spiritual beliefs and her commitment to serving humanity. Legacy and impact. Florence Nightingale's legacy is profound and enduring. Her pioneering work in nursing and healthcare reform transformed the profession and laid the foundation for modern nursing practices. Her emphasis on hygiene, sanitation, and patient-centered care revolutionized healthcare and saved countless lives. Nursing education and professionalization. Florence's establishment of the Nightingale Training School set the standard for nursing education and professionalization. Her emphasis on rigorous training, ethical standards, and evidence-based practice became the cornerstone of nursing programs worldwide. The principles she advocated continue to shape nursing education and practice today. Florence Nightingale's contributions to public health and statistical analysis have had a lasting impact on healthcare policy and research. Her innovative use of data visualization and her advocacy for evidence-based practices continue to influence public health initiatives and epidemiological research. Inspiration and recognition. Florence Nightingale's life and work have inspired generations of healthcare professionals and reformers. She is celebrated as a pioneer and a symbol of compassion, dedication, and innovation in healthcare. Her legacy is commemorated through numerous awards, honors, and institutions bearing her name, including International Nurses Day, celebrated on her birthday, May 12. Florence Nightingale's remarkable life and contributions have left an indelible mark on the field of nursing and healthcare. Her pioneering work during the Crimean War and her subsequent efforts to reform healthcare practices revolutionized the profession of nursing and laid the foundation for modern public health initiatives. Florence's legacy continues to inspire and guide healthcare professionals around the world, reminding us of the importance of compassion, dedication, and innovation in the pursuit of better health outcomes for all. Her enduring influence on nursing and public health serves as a testament to her vision and unwavering commitment to improving the lives of others. Thank you for watching.